Hi, I'm Dr. Gerard Gianoli. I'm a neuro-otologist in Covington, Louisiana, and today I'd like to talk to you a little bit about something called benign paroxysmal positional vertigo. I am sometimes asked the question, can loose crystals cause dizziness? Well, the answer is yes, absolutely. The most common cause of dizziness seen in balance disorder clinic is benign paroxysmal positional vertigo, BPPV. BPPV is caused by loose crystals floating around in your inner ear that give intermittent abnormal signals from the balance sensor to produce the symptoms of vertigo and dizziness. BPPV is seen in all age groups from children to adults, but becomes increasingly more common as we get older. It is so common that among those over 70, probably 3 or 4 out of 10 people over the age of 70 have BPPV and don't even realize it. They just assume their balance is bad because they're getting old. BPPV can cause a short-lived, less than a minute episode of spinning sensation that typically occur after a change in the head position. On the other hand, it can also cause a more chronic, ill-defined dizziness where every head movement produces unusual feelings, but not necessarily a spinning sensation. The inner ear has 2 different types of balance sensors, the semicircular canals and the otolithic organs. The semicircular canals are sensitive to angular acceleration, rotating your head side to side or up and down, and are stimulated by the movement of the fluid in the semicircular canals. The otolithic organs have crystals on top that give the sensors weight and hence are sensitive to gravity and linear acceleration such as moving forward, and side to side or backwards. The problem arises when the crystals of the otolithic organs break loose and float into the semicircular canals. This leads to a sensor that is supposed to measure angular acceleration, such as rotating the head, suddenly becoming stimulated by gravity. This produces vertigo and dizziness. There are 2 broad categories of BPPV, primary and secondary. Primary BPPV is BPPV with no obvious cause. This is usually the case in many of the elderly, where the crystals have become fragile with age and are starting to break loose. Secondary BPPV is BPPV caused by some other problem. This is the case in most of the younger patients, but also in some of the older patients. In this scenario, the crystals are knocked loose by some other problem. Head trauma is one of the more common scenarios, but other inner ear problems such as Meniere's disease, which is too much fluid in the inner ear, perilymphatic fistula, which is fluid leaking from the inner ear, vestibular neuritis, viral infections of the balance nerve, and other inner ear disorders can be the culprit as well. Treatment of BPPV is highly successful. In the case of primary BPPV, canalith repositioning using the Epley maneuver, or for the more complex cases, the Epley omniax, is curative in greater than 90% of cases. Canalith repositioning is a single-time treatment that through a series of varying head positions, the crystals are floated out of the semicircular canal and into an area where they cause little problem. In the case of secondary BPPV, the treatment is geared toward fixing the initiating cause first. And then canalith reposition is to take care of any residual crystals. In cases that are recurrent or resistant to treatment, there are surgical treatments such as plugging the offending semicircular canal that are also highly effective, resulting in greater than 90% resolution rates. So in answer, yes, loose crystals can make you dizzy, but you don't have to live with it. Thank you.